With the advent of super specialty and multi specialty hospitals and them offering medical care at rates much lower than that in the developed world, India has become the primary choice for medical tourism for people around the world. But what might otherwise seem inexpensive to the developed nations has gradually started taking a toll on the average Indian's pocket. So, what is it exactly that has made healthcare in India such an expensive affair? For starters, the number of people visiting hospitals has steadily increased in the past decade. From what was about 31 out of every 1,000 Indians being hospitalized in the year 2004, the number stands at a staggering 44 out of every 1,000 according to the 2014 NSSO report. As per the same report, more than 70% of these cases were dealt with in a private sector setting. And why not, considering the fact that our public healthcare system isn't capable of handling the number of patients visiting these centers on any given day. On an average, as many as 10,000 patients reach AIIMS for a medical consult every day. And as a result, it takes months for even those with terminal diseases like cancer to get started with their treatment. Capitalizing on this sorry state of our public healthcare system and the absence of any initiative on the government's part to improve the situation, the private sector has invested heavily to make healthcare much more accessible. But the increase in access has brought along with it a massive spike in cost. Between 2004 and 2014, the average medical expenditure per hospitalization has increased by about 176% for the urban patients and by 160% for the rural ones. Typically, what would cost Rs 5,636 in a public sector hospital will amount to Rs 21,726 in a private hospital. A recent research on the quality of medical care provided in public and private hospitals in India by Jishnu Das and Alka Hola of the World Bank, Akash Mohpal of the University of Michigan and Karthik Muralidharan of the University of California shows that although private medical practitioners may often overcharge their patients and recommend unnecessary tests, on balance, they are more likely to provide better quality care compared to public hospitals. But that's not all that has made healthcare a financial nightmare for most Indians. As per the latest NSSO survey, close to 86% of rural Indian patients and 82% of urban Indian patients do not have access to any form of employer-provided or state-funded insurance. And as a result of which, out-of-pocket healthcare expenditure in India is higher than in most emerging economies. And while the unprecedented advances made in medical science are priceless, the rapidly swelling prices of healthcare services in India has ironically managed to make our lives a bit more complicated.